Could I put my question, or I'd like to read something to you, if I may, UKIP. Dear Editor, I would like to congratulate the Coalition Government for bringing a whiff of privatisation into the beleaguered National Health Service. The fact that successive governments have undertaken what they call substantial changes to the NHS should tell us that all that we need to know. There is something fundamentally wrong with how we treat the ill in our country. The NHS is the second biggest employer in the world, beaten only by Walmart. As with all state monopolies, it is costly, inefficient and stuffed with bureaucrats. In New Labour's NHS, for every nurse there is a manager, and vital workers such as midwives are falling in numbers. The problem goes far deeper. I would argue that the very existence of the NHS stifles competition, and as competition drives quality and choice, innovation and improvements are restricted. Therefore, I believe as long as the NHS is the sacred cow of British politics, the longer the British people will suffer with a second-rate health service. That is your Deputy Leader, Paul Nuttall, UKIP, MEP. Those are his words on his website. Two of your main agendas is 31% tax rate on everyone, from cleaners up. Secondly, I also come from an Indian background. As you can see, I'm pure white. I'm thrilled to be part of your DNA. Thirdly, it is well written, well out there, that you will end the NHS, probably even more quickly than the quite cruel Tories. Would you like to answer my question? Thank you.
Go there.
Simon, go ahead.
Okay. Basically, my mother was an SRN, state registered nurse, many years ago. She also became matron at Old Hay Children's Hospital in Liverpool. She's noticed massive changes with regards to what's been happening within the NHS, and that's because of lacking of investment. Both my parents both suffer, they're very much elderly now. My father's 89 and my mother's 83. Both require more help and support from the local hospital as and when they need it. Okay. I can't comment on what's being said specifically by the senior members, which I'm not going to comment on at this stage. Okay. All I do know is that I'm actually trying to support prevention of the closures of the accident emergency. There's an elderly population, and it's becoming much more so. There's going to need to be more investment in the National Health Service in order to accommodate the ageing population. So, like I say, I'm fairly new to this whole scenario. I'd be more than happy to have a look at all these things that we've said.
Do you believe in privatisation? Your leaders believe in privatisation. They want the end of the NHS. They've said it's the sacred cow.
Hang on, Jan. Just because I don't know if everyone will hear you, what Jan is saying is that Paul Nuttall, the Deputy Leader of UKIP, spoke to say that the NHS is a big state monopoly that's very inefficient. It needs its budget cut and it needs much more privatisation. And the question is, does Simon agree with that or not?
Well, I'm not necessarily agreeing with everything that's being said, but one thing I do understand...
Sorry, Simon, could you just answer that question? Do you agree with the privatisation of the NHS?
No, I don't. No, I don't believe in privatisation.
So does your party have a policy statement which it doesn't do with all other? Have you got a written policy statement?
It's on his website.
So hang on. So what we have is Simon saying he doesn't agree with privatisation. We have the Deputy Leader's statement that he is for privatisation.
I don't necessarily think he's saying it's full of privatisation. One of the things we have got...
Simon, I mean, just as a pure matter of fact,
okay.
It literally does say that he says... Nuttall says he's for the privatisation of the NHS. Yes. So you're against your party on that?
I'm not saying anything about it. I'm not going to comment on that one. I thought we were here to discuss Charing Cross Hospital closure.
Hang on, please let Simon speak. Please let Simon speak.
I thought we were here just to discuss, first of all, how we can all join together to try and prevent, first of all, the closure of Charing Cross Hospital. Okay? Whoever gets elected after the 22nd of May is irrespective. The one thing that is a common goal is to prevent Hammersmith and Charing Cross Hospital Accident Emergencies from closing. And that's exactly what I'm here to try and help do.
Hang on,
Don't know yet.
sorry, just...
it's working
well, okay, so Jan said how, and Simon said he didn't know yet. What the other part of the question was, the bit about UKIP's policy saying that it wanted to cut taxes and cut public spending. Paul Nuttall also says that he doesn't think the health service should be ring-fenced, so money shouldn't be protected for that. What's your position on that? Because that was the other part of the question.
I'm not going to be able to comment on those with regards to taxes and so on and so forth. I'm here.
You're talking about how can you be a councillor representing the population and you don't know what your local population want, and you can't tell them what you're going to be doing? That does not make sense to me.
Okay.
It's like going...
Okay, I want to move on now. I think you've raised that issue. There are some more hands up, so I'm going to ask other people.